I'm gonna do this. Fuck. All right. Why should the U.S. government federally legalize euthanasia? Death is a part of each person's life. We all face it, and unfortunately, many people find themselves at the end of their lives sooner than they would prefer. Terminal illness, in particular, puts dying people in a position where they are often aware of their situation for some time, weeks, months, or years. And in these circumstances, especially when in pain or very low quality of life due to illness, euthanasia should be an option so that one's end-of-life experience can consist of less suffering for patients and their loved ones. In addition to the ability to provide a comfortable end of life for patients and their loved ones, death is a human right that we should be able to choose, and contrary to popular belief, euthanasia should be an important component of the Hippocratic Oath, not a violation. And for these reasons, the U.S. government should federally legalize euthanasia. Euthanasia allows for less pain associated with terminal illnesses such as cancer, which is the most common of in euthanasia cases, but also including AIDS, Alzheimer's, or dementia, diseases that deteriorate the mind to a state of confusion. According to Professor Roger Crisp of the University of Oxford in his article, Assisted Dying and Protecting the Vulnerable, the most significant vulnerability in many of the terminally ill is the agonizing, chronic, and unrelievable pain. He argues that, at a minimum, patients should at least have the choice to initiate their death to avoid further suffering and low quality of life during their final period of life. Euthanasia allows for relief to families and loved ones that have been accompanying an ill patient through the pain of dying. In a study of euthanasia cases in Europe, pain was the reason for euthanasia in about half of cases. Loss of dignity is mentioned as a reason for 61% of cases in the Netherlands and 52% in Belgium. Euthanasia allows loved ones to plan for afterlife arrangements and allows for the ill to prepare for their death, making arrangements to see friends and family, to write their will, or to make last wishes. In addition to an improved end-of-life experience, death is a basic human right. There is no harm done to others by ending one's suffering, and euthanasia should be a choice for anyone in a state of constant pain due to terminal illness. For those that are opposed to the legalization of euthanasia, they are often concerned with the devaluing of life. If euthanasia allows us to end our lives in sickness, why wouldn't people think of life as less important? According to Richard Doerflinger, at the Center for Ethics and Culture at the University of Notre Dame, he says that campaigning to end certain people's lives doesn't end suffering. It passes on the suffering to other similar people who now have to fear that they are the next people in line to be seen as having worthless lives. And people who have died from a drug overdose have no freedom of choice at all. Moreover, societies that authorize suicide as a choice for some people soon end up placing pressure on them to do the right thing and kill themselves. Seeing suicide as a solution for some illnesses can only undermine the willingness of doctors and society to learn how to show real compassion and address the needs of patients' pain and other problems. So what are the guidelines that constitute euthanasia? What degree of sickness is necessary to decide that it's okay for health professionals to assist in the dying process? So there are 7 states in the United States that have a form of euthanasia that's legalized. And for example, in Oregon, that form of euthanasia is actually assisted suicide. So as opposed to a physician administering a lethal dose of medication to the patients will have to self-administer the lethal medication. And the guidelines, the requirements for a patient to qualify for assisted suicide in Oregon are that they must be a resident in the state of Oregon, they have to be at least 18, and they have to make 2 oral and 1 written requests for euthanasia, terminally ill with a life expectancy of less than 6 months, and this prognosis must be confirmed by a second consultant physician. And both doctors must confirm that the patient is capable of making this decision. They can't be in a state of confusion due to their illness, or otherwise the family or designated persons would make that choice for that person. And both doctors have to confirm that the patient does not have a medical condition that impairs their judgment, and they have to self-administer the lethal medication. So, while many can see the benefit and necessity of the choice of euthanasia, a roadblock for many health professionals is the heavily debated responsibility to do no harm. It is difficult to justify euthanasia or assisted suicide based on this ideal. However, when in a state of anguish and close to death, euthanasia is not harmful. In these end-of-life situations, euthanasia allows for more comfortability and less harm to the mind and emotions associated with the dying process. Finally, euthanasia should be an important component of the Hippocratic Oath, not a violation. Euthanasia allows for loved ones and the patients themselves near the end of their lives to avoid the emotional and physical pain associated with the end of life. In a recent study, the bereaved family and friends of cancer patients who died by euthanasia had less traumatic grief symptoms, 95% confidence. Oh my gosh. They had less current feelings of grief after a year and less post-traumatic stress reactions than the family and friends of patients who died of natural causes. These differences were independent of other risk factors. And in her article, Euthanasia Easier on Loved Ones, Serena Gordon of Health Day reports, the researchers suspect there are several reasons friends and family of people who died by euthanasia had fewer symptoms of grief. One is that they had time to prepare and talk about the death. Another is that they had the chance to say goodbye to their loved one. According to the study, this planned end of life allows for families to prepare themselves for the loss and helps reduce the grief of watching their loved one experience a painful death. In circumstances of terminal illness, especially when in pain or very low quality of life or inactivity in the brain, euthanasia should be an option so that one's end-of-life experience can consist of less suffering for the patients and their loved ones. And death is a human right that we should be able to choose, and contrary to popular belief, euthanasia should be an important component of the Hippocratic Oath, not a violation. For these reasons, the U.S. government should federally legalize euthanasia and allow people suffering from terminal illness to increase the comfortability of their end-of-life experience. Patients, especially in a state of uncertainty, such as dying, deserve to have options and the support of medical professionals. In some cases, the terminally ill often decide to take their own lives. This sort of scenario, while perhaps appropriate from the perspective of the patients, is not comforting to family members or the patients themselves. Terminally ill patients deserve to have the choice and the medical expertise to assist them in an end-of-life procedure.